Hello, future nurse. So welcome back to this video lecture of and playlist of communicable diseases and infectious diseases. And we are on to our next communicable diseases. And I'm glad that you are still here and watching, listening to this video lecture. And I hope that you're learning something that is beneficial for your studies, for your review, and for discussion purposes. And please, again, do not forget to subscribe, like, share, and notify yourselves of this channel. I'll continue to upload video lectures that will help you on your studies, not only nursing but also midwifery and other allied health sciences students. So, we are going to discuss on this video lecture um, the disease that is also respiratory in nature, which is diphtheria. So, as you can observe, I'm just discussing as if I'm conversing because that's what I'm comfortable with. Okay, so let's start. So, diphtheria affects the mucous membranes and also wounds, if ever there are open wounds. So, any uh, mucous membrane possible for infection is affected, and it is caused by a bacteria, a bacillus, which is your Corynebacterium diphtheria or Klebsiella bacillus, and it's transmitted through droplet, and the incubation period is 1 to 7 days or 2 to 6 days in other references. Diphtheria is a contagious disease, it's an acute contagious disease, and usually this is characterized by generalized toxemia from a localized inflammatory focus. Okay? And there is a reference telling that infants are immune for 6 months of life from the vaccine, and the toxin that is produced by the bacteria is capable of damaging muscles, especially including cardiac muscles, the kidneys, livers, and the nerves. Okay? And higher incidence happen usually on cooler months, and mainly a disease of childhood with peak rates at 2 to 5 years. And usually this is uncommon, although it can happen. It is uncommon on um, children was is older than 6 months. Okay. So incubation period is, as I've mentioned in the previous slide, is 1 to 7 days, 2 to 6 days. But I have mentioned in my previous video lectures that there are some references would be giving other numbers or durations. So you better check it, and usually on examinations choose the best one. Excuse me. So the period of communicability varies, but there are some books saying it is usually 2 to 4 weeks if left untreated, and there are also books saying 1 to 2 days once it is treated. Okay? So there are certain types of this disease. First, we have the nasal type, and usually these are the manifestations. Manifestations are clustered into different types. In the nasal type, there are nasal passages uh, which is affected, irritating nasal discharges. It is usually serosanguinous in characteristics, and it has a foul, mousy odor. Um, the upper lip is affected by the presence of the pseudomembrane and this is the pathognomonic sign of diphtheria. Okay, so again, this is nasal type. The infection is on the nasal part, and it is with the presence of a nasal discharge, which is serosanguinous, and with the foul mousy odor. Then another type is pharyngeal or the fossal type. It affects the pharynx and tonsils, and usually this is manifested by a pseudomembrane on the soft palate and walls of tonsils, accompanied by sore throat, and the patient may have dysphagia, and also the patient may have these manifestations. The bull neck appearance. This is due to inflammation and enlargement of cervical lymph nodes. Okay. And the other one is the laryngeal type, so it's the larynx and also part of the tonsils. Hoarseness of voice, since the voice box is there. Loss of voice for more intense cases. The patient may experience difficulty in breathing, chest indrawing, cough, which is a barking characteristic, dry metallic cough, and husky cough, and also possible wheezing. So these are all combinations of manifestations based on different references. Yeah, so sorry, as you can see, there is the pseudomembrane. Okay, yeah. Another image for that is this one. Okay, so as you can see, you can include the airway passage, in the mouth. Okay, that's the pseudomembrane. Usually, it's grayish, whitish, cheese-like substance. Diagnosis: there are two commonly referred diagnosis. We have the Schick's test and the Maloney's test. Schick test is a test to determine immunity in susceptibility, and Maloney's is a test for hypersensitivity to diphtheria antitoxin. Okay, and what is definitive here is also the nose and throat or culture or swab. This is to identify the microorganism and to determine the communicability, okay, of the disease. And treatment is really to neutralize the toxin produced by the bacteria. And usually what is given here is the anti-diphtheria serum, and it's an antitoxin. So it rapidly should be, okay, affecting or produces its effects to treat the diphtheria disease. And since this is a serum and it comes from other sources, skin testing is needed. Okay, if the patient is hypersensitive, you can administer antidote epinephrine, as you all know. Okay, and treatment of choice or drug of choice, as we commonly refer, is antibiotics, which is penicillin. Okay, so this penicillin has the action that kills the microorganism, and if ever the patient is not good to take penicillin, um, the, the prescriber may opt to choose erythromycin. Okay, and this is supportive care. So nutrition is emphasized, fluid electrolytes is also emphasized, um, bed rest, and this is to decrease oxygen demands and to further decrease chances of complications. If ever it worsens, administration is needed, and also if there is really a severe obstruction, uh, or a higher chance of obstruction, A tracheostomy set should be always ready. Um, in terms of the diet, it should be soft diet, small frequent feedings, and ice collar usually is also recommended to relieve pain from the neck area, and proper hygiene, especially mouth care. Okay? Mouth care is emphasized. So that's a short and simple review or presentation discussion of the disease diphtheria. So I hope you have learned something again and add up in your knowledge in communicable diseases. So this is good for community health nursing and primary health care, and also good to teach this information to others. And again, do not forget to subscribe, like, share, and notify yourselves for upcoming videos. This is your SIRONE, your online nursing educator, and God bless. See you in the next communicable disease lecture. Thank you.